All right, good morning, folks, and welcome to Friday Chalk Talk. Today, we are lucky to be joined by Rachel Gage. She's an advanced practice nurse practitioner here with our system and advocate Aurora. And when I ask her colleagues that know her the best what we should know about Rachel, they tell me that in addition to, of course, the obvious of being a little envious that she sailed around the world on a cruise ship and has been on all 7 continents, that the most the most important thing, and I quote, Rachel has the heart and soul of a humanitarian, and she is
Oh,
an inspiring and rejuvenating person to be around. And so, Rachel will
that's
be.
kind.
Oh,
I'm blushing. Whoever said that, thank you.
and so we're lucky to have Rachel today. She's going to be talking with us about one of the most important topics in medicine right now, self care. And today's format's going to be 2 parts: short presentation, a little bit of discussion sprinkled in, but most of the discussion saved for the end. And so, with that, Rachel, welcome, and I will hand the platform over to you.
Thank you. Welcome, everyone. I'm glad you're here. And today's topic is why should I self-care? Of course, you all care day in and day out for your patients and your families and probably your pets, etc. But we want to talk about why paying attention to intentional time for self-care is so important. A few objectives, because we always have fancy objectives in medicine. We're going to talk about definitions for self-care, identify methods of self-care, talk about the evidence and the rationale. I want to talk to you about possibly an IDT approach to your own self-care, and then also define compassion fatigue and burnout and why it's so essential that you pay attention to prevention instead of just address a fire and an explosion once it happens. So a lot of people think of self-care as a cucumber mask, maybe a day off, a pedicure, something like this. But really, self-care isn't a one and done. It's not like the Johnson & Johnson vaccine where you get one and you're good for COVID. Or you take one vacation and you've checked that box for the year and you're good. So our work in palliative and hospice can be very difficult. Working in healthcare in general can be really difficult. There's a lot of personalities. There's a lot of team members to talk to and to juggle and coordinate. The work can be emotionally exhausting. It can be very tiring. So we want to pay attention to our self-care and also be very mindful and intentional about making sure you really schedule it. I want to encourage everyone to have a pen and paper handy. If you've got one around, I want you to doodle while I talk. I want to see what comes up for you guys at the end and kind of just see what topics or what sort of ideas you come up with by the end of this. So a few definitions. WHO defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health with or without the support of a healthcare provider. Compassion fatigue is physical and mental exhaustion where you start emotionally withdrawing because you are so overwhelmed and so exhausted from dealing with sick or traumatized people over an extended period of time. And of course, a stress is basically just a force, right? If you go back to your physics, if anyone took physics 101, stress can just be the force of something applied on you. Basically, the main thing to think about is stress is characterized by overengagement. Stress, your emotions are overreactive. Stress, you're feeling urgent, like I gotta jump. You feel sort of on pins and needles all the time. You have lots of energy. You're responding to that flight or fight sort of situation in your body. But stress can really lead to anxiety disorders. And you look at the primary damage in stress as physical. When we talk about burnout, this is the World Health Organization's definition of burnout. Burnout is characterized by disengagement. That's where stress has gone over the top and you've gone too far. Burnout, your emotions are blunted. You don't really feel, you don't care. Burnout produces helplessness and hopelessness. Burnout also can lead to loss of motivation, loss of interest in things that you normally would love and feel very passionate about. Burnout can really lead to serious depression. And burnout, the primary damage is really emotional. So I know what most of you are thinking. I've got a family, I've got kids, I've got my job. I can't think about my self-care till I'm retired or till I have my PTO days off when I go on my vacation. Then I'll take care of myself. But I would argue that if you get to that point, you've probably let it go too far. So let's just start with a few minutes. What can we do for a few minutes? So you can put in the chat box or you can unmute for a few seconds and just call out some stressors. I want to hear from you guys out there. I want to make sure you're awake. It's not that early, but still make sure you're awake. So add in a few, but a few things that people have mentioned before to me is, family can be overwhelming, financials, balance of work life, trying to figure out fitness, you're trying to get that healthy living incentive. So you want to lose the last 5 pounds and that's stressful. And then as you're adding in a few comments, what do you do weekly to self-care? Do you do something weekly to self-care? And yes, exercise, as you see our lovely lady down at the bottom is doing some sort of yoga pose. Exercise is self-care as long as you're doing it. So why do we even have to think about this? Well, your body's telling you need a break. You can't run on empty, just like a car can't run on empty for very long. You might be able to do it for a little while, but eventually it'll certainly catch up to you. As you get more overwhelmed and more burned out, your work becomes less productive. There's a lot of significant evidence that shows that if our healthcare providers are burned out and exhausted, there's a higher rate of turnover, which means a big cost for the company because they have to train new employees, which is kind of a pain in the neck for them as well, because they've got to recruit and then go through training and get everybody up to speed. But think about your own self. If you just take a minute and take in a deep breath and say, how do I feel? Do you feel in the majority of the time, do you feel cranky and stressed and sort of on edge and frustrated with life? Do you feel content and happy? It's about kind of finding your balance and figuring out what is that sweet spot. And also it's about creating a supportive culture for you, but also for the team members who are around you, because we're not in a bubble, right? Even though COVID makes us feel like we're in a bubble, we're certainly not actually in a bubble. So we've got the hypothalamic pituitary adrenal axis of flight or fight, right? So we know that if we are stressed to the point of burnout, our bodies are bearing so much than just the usual wear and tear, right? We've got that increased blood pressure, we've got that increased heart rate, pain and discomfort, our shoulders are up to our ears and we're just feeling not ourselves. And these are some of, I just like this picture because it was so chaotic. It felt very like, oh no, flight or fight. And there's a lot at the top. You can see a lot of diseases of adaptive stress response. And these are not 100% that every person who is stressed will get these diseases, but they are certainly very likely amplified in people who carry high stress and have that high risk of burnout. This is another chart that I found that I really liked because it kind of was very visual, and I added a cranky cat for the danger zone, the red zone. You don't want to find yourself in the cranky red zone. Often, I mean, of course we get there, right? We get a page and we have to run to the emergency room and deal with someone who's possibly actively dying or something, and the caregivers are stressed and it can be very stressful for a while. But then you want to find your way back to where that big, beautiful, fluffy heart is, where that's your optimum performance. Your arousal is medium, but you're able to respond to the events that happen day to day. You're able to cope with your workload. You're able to manage the workflow very nicely, and you're able to find balance. And ebb and flow is really essential. Really essential. We don't want to stay in the high stress panic zone very often. So how do you find your balance? You can be like Waldo and wander the world, or hide, right? He's always hiding out in amongst big chaotic scenes. One suggestion that I have is to take a look through the IDT lens. at yourself. So we esteem our IDT team members as each individual expert in their own field, correct? So everyone's an equal, they contribute strongly to our patient care experience and evaluation, and we want a chaplain's insight. We want that social worker's insight into that patient scenario to figure out how can we give them the best care. So I would challenge you to look at your own life through the IDT lens. So if you're a doctor per se, take a look at your life via a social worker lens. What are you deficient in, possibly? Or where could you make some adjustments where you could be your best self? The beauty of this is it really incorporates some interesting viewpoints that you normally might not contemplate. But it also really responds to the multiple dimensions that we are, right? We get so stuck. I'm a nurse practitioner, so of course I have to think like a nurse practitioner all the time. But if I put on the hat of a social worker or a chaplain or another IDT expert, maybe there's a deficiency that I should pay attention to. And I am by no means saying that I am perfect. I'll be the first to raise my hand and say, ooh, I could do more of this. But it's more of just a gentle nudge to looking at yourself and really taking care of yourself the best way that you're able to. I love this chart because number one, I'm kind of nerdy and I like nerdy charts, but number two, it really has a beautiful setup for where there's a positive value on the side, which these are a lot of the positive aspects that we go for when we're getting hired at a company, right? We want to have excellence and compassion and all these things. However, if they are let to go too far, they often can turn into a negative trait. So you can see where compassion, if you always are giving so much compassion, but you don't take time to renew, then you end up with significant isolation because you are burnt out. And that can lead with the burnout factor to depersonalization. And then on the end, this is my favorite part of the chart, is it really gives you a tangible intervention where you can make improvements. So using silence to renew yourself, taking time away from giving your compassion to everybody that you see during the day and turning it towards yourself. Taking time for connection and renewal and resilience, so important. Anyway, you can come back to this slide because we can mail out the slides later. But one resource that I'd like to bring to your attention, and of course we hear about this, right? We know the EAP exists, but they actually have more services as I was researching this than I was aware of. So they can help with financials, legal recommendations, child and elder care referrals, resources, but they also can be a resource if you're just having high stress and you don't know how to find your way out of it. Over in the left-hand side, it says team members receive 4 EAP sessions in person, by phone, or video with Zoom. That can help you with skill building, skill set improvement and that sort of thing, but they can also just offer you support because sometimes it's nice just to be able to complain to someone who's not your family. And get that support where they're like, I hear you. A little evidence-based research, and I found so much research that I certainly could not incorporate more than 2 little studies. But this was 10,184 staff nurses who were surveyed in Pennsylvania, and they really found that the nurses, because they were so burnt out, had a high patient to nurse ratio. So the nurses who had those high patient to nurse ratios in surgical patients had a higher risk adjusted 30-day mortality rate, and as well as fail to rescue rate. So the nurses were getting burnt out. And I saw this over and over again in study after study, not just with nurses, I have to say, with doctors as well, with usually with providers is unfortunately where the bulk of the research really looks at. But I would think it's fair to assume that this is sort of universal across the board for healthcare providers in general. You know, if you're the only social worker in the hospital for that week because everyone's called out or they're sick or they caught COVID or whatever, I'm certainly sure that you would also feel this significant stress. There was another research about the stress combined from work, marriage, and children. It's not just always work. I know we like to blame work, but it's everything together. And in general, if you have that emotional exhaustion, you are depersonalizing your patients. You have less satisfaction with your job. You're more likely, again, to have turnover, more likely to leave, more likely to just feel discontent and unhappiness in the job, which, as you know, you got to go to your job, right? We all have mortgages or bills. So you got to find a way to find the balance. So this is a lovely chart because it reminds us that we can't just go to the gym to work out to solve our problems, right? We've got our physical aspect, but we also have an emotional and spiritual aspect. Whether or not you're religious, a lot of people would argue that there's still that balance in your soul, whatever that means to you, I don't know. But there's a social aspect that you need to pay attention to, which I would argue a lot of people have been really deficient in the last year. I know for me, I feel like I've lost contact with a lot of my acquaintances just because it's sort of just text messages lately, right? Normally we'd meet up for a barbecue or something, but up until recently, people haven't really been vaccinated. So it's been hard to think about that. But really want to just encourage you to examine the different aspects of self-care. And again, look at it through that IDT lens. If you're a social worker and you haven't thought about looking at yourself through a chaplain scope, what could you do to improve your overall balance and care? So what do you see when you look in the mirror? Are you living up to your potential? Are you a little fluffy kitty and that's okay? Or are you a big, strong lion and that's okay too, right? Again, it's you're the person who the challenge is for. You're not up against anyone else but you. In talking about resilience and renewal, this was a beautiful, tangible example that someone had posted online, and I've got the credit at the bottom. But if you're stuck, if you feel like there's just little moments that you can't quite figure out for work, relook at your passion, figure out how to find your passion so you can find your energy and get rid of those negative stressors. Look at your relationships. Did you know that you need 5 positive interactions for every negative encounter? I mean, there's research on this. I'm not the expert, but that's what the research says. So if you are having a lot of negative interactions with your teammates at work, try to turn that around in some way. And it doesn't all have to fall on you. I would encourage you to recruit team members or others to help with it. Think about being an optimist. I know optimists, well, Pollyanna, blah, blah. But if optimists are evaluated, they look at problems as short term. They look at it as a small little thing to figure out, and they look at the big picture as far as how do we really find a positive way out of this. So I'm not going to tell you to totally change your nature if you're more of a pessimist, but maybe add in little sprinklings of optimism. Be proactive. Think about your own strengths. And if you're not optimizing them, think of a way to optimize them. If there are places where you don't feel utilized, that you know you have a gift or a talent, maybe explore that so that you have better job satisfaction. Think about your energy, right? We want to conserve our energy and figure out where we can conserve our energy. I know for me, I've had the same end of life goals of care conversation with this wife of this activated patient for about a week now. And the team keeps saying, well, can you have another goals conversation? And I say, I could. I mean, I'm here to offer support, but let's conserve our energy for when this family will actually listen, right? Let's kind of find a balance. So that sort of thing, just being mindful of your own energy. And then lastly, and this might sound a little maybe dismal coming, but what is your legacy? And I don't mean like you're going to die tomorrow, although we never know what's going to happen. But what is your legacy in the grand scheme of the big picture of you? What is it that you're leaving behind? What is your purpose, and what extraordinary results or what extraordinary goals are you going to move towards? I was talking about the acquaintances and how we've kind of lost our acquaintances. So I want to just remind you that there's a million ways to reconnect with your tribe. But really at the bottom, make sure that you have enough time for you away from work. Take your PTO, take your time off, take your CME days and really make sure you take space away from the busyness and the hectic scramble. Take some time for grief. This whole last year, 365 days have been unlike anything we've ever dealt with before. There's been a lot of losses, some people, physical people that we've lost, and some just relationships or other things that don't work the way that we were expecting it all to work. And so really take time to acknowledge and accept, what is lost, because things have been lost. Make sure you reach out if you feel like whoever this poor person is under this mound of papers, if you feel this overwhelmed, make sure you find someone, because the bottom line is we're a big team. You're never alone, even though you might be the only person working at one isolated location or zip code. But there is always someone who cares, and there is always someone who is there to help and be present. And think about the supportive culture. If you see someone sort of looking like they're drowning and they're putting up their flag, their white flag, saying, help, help, try to be mindful and aware so that you are able to be a voice of concern and a voice of support for those folks. So how do we endure from here? I want to encourage you to be self-aware. Do we have difficult times ahead? Who knows? But continue to find your resilience despite the challenges. Encourage you to transform, to find your compassion, your empathy, and your balance. I love Pema Chodron. She's this Buddhist monk who writes some really beautiful books. And her main essence is that just accept what you are right now. You've got to take a deep breath and accept where you are before you can move forward. You are beautiful, you are worthy, you are important, you are special, you are unique, you are wonderful, and you are irreplaceable. And you do deserve to take time for you, and you do deserve to take time for your own self-care. We don't want any of you guys to burn out. We want you to have beautiful, fulfilling lives, and everyone is certainly worthy of that. And if you have time and it doesn't add to your burnout or stress, volunteer. I know the engagement surveys are coming out, and my big mission is to ask Advocate Aurora if we can have a paid day off to volunteer. I know we all get paid time off, and we can certainly volunteer with that, but how beautiful would it feel like we're maybe creating a legacy if we could, with our work, engage and dedicate time to our community. The source of this is my sister actually works for a company, and they give her 10 days of volunteer paid days off. And I thought, ooh, 10, that's a lot to ask for, but maybe we can ask for 1 or 2. So if you get an engagement survey and you like my idea, feel free to steal it and write it in. But I miss volunteering. I feel like in the last year, because everything's been so shut down, volunteering always renewed me, and I haven't had much of a chance. So that's one of my self-evaluation things that I need to get back to. So what did you doodle? I want to invite you to unmute, and maybe Marty, we can look at the chat box and see what people were saying and what people have been thinking about, what sort of thoughts any of this prompted. And I want to think about, what did the last year teach you about courage? Did you make any new discoveries about yourself last year? What did you celebrate? There were still a few things to celebrate despite a lot of despair. What did you learn about society? What about the preciousness of life? Did your capacity to endure surprise you? What would you keep from the last year, and what would you leave behind and never look back at? And then what is the single most important thing that really helped your mental health, and how can you move forward from here? So talk to me, don't be shy. Or talk to Marty. He's really the person in charge.
I'll go first. I'll go first. So one thing that I've been practicing over this last year that I did not come up with, and I'm afraid I just cannot remember where I learned this from, so I don't know who to give this credit to. But every day when I drive home, I try to say out loud, you're leaving work, you're going home. What sort of husband do you want to be? What sort of father do you want to be for your son? Trying to find ways to make it so that I'm not coming home grumpy and I'm leaving, because sometimes we all have grumpy days, and leave some of what is difficult at work and come home being the person that I want to be for my family.
I know we had some comments in the chat box too about what sort of things people were doing and what sort of things they want to be doing. And I know you wrote, Marty, missing dinner with the family. Casey wrote figuring out fitness. Shannon wrote money as far as a stressor. Katrina wrote balancing being a mom, wife, and NP, which absolutely. Shannon said, learn the banjo. I'm not sure if that's like a group suggestion, like we should all learn the banjo or she's going to learn the banjo, but it sounds like fun. I don't have a banjo though. Casey says meditation, which I'd love to get back into. Kelly says string of the most difficult families. Yes, when you have those weeks where the families are just not listening, that can be so difficult. Nick says weekly for me is exercise, meditation, and quiet time. I think we forget that we have to make time for those things sometimes. Kelly says sewing and gardening. Now is the season for the gardening. Marty says carve out protected time and have the entire family and schedule to be on board. Yeah, that can sometimes be tough too with little kids, especially, or with big kids, because big kids are probably more opinionated than little kids. Carrie says games with friends. I miss that. I miss people. Ashley says exercise and learning Spanish. Carrie says virtual games with friends. Brenda says exercise, doggy time, date night. Kelly says some of us are more in a bubble than others. This is true, especially with some of the more remote locations. Shamaha says, I miss volunteering and the purpose it added to my routine. Shannon said, I discovered new and surprising friendships. I'd love to hear more about that, Shannon. And Corinne said, the thing that helped me the most is the lens of spiritual care. Roberto taught her that nobody's perfect. Brenda says she did a ton of baking and now she makes her whole grain bread weekly. And she enjoys extra time with her teenagers, especially great with one headed off to college. Nice.
I had a couple of things that I think the last year really highlighted for me. One of them is the importance of human interaction. And while it may be more on Zoom now than it is or was before, face-to-face interaction with people, hopefully in person, really, I've learned to appreciate it in real time much more than I used to. So I think the deprivation of spending time with friends and family for so long has made me truly appreciate every moment that I have with people. And then the second thing for me is I tried meditation when I was younger and I found it really difficult because I went through the formal training and finding the time to do it seemed impossible. But meditation can be 1 minute, it can be 5 minutes, and it can be 10 minutes. It's just that quieting time when you self-reflect a little bit. I found that really helpful in the last year.
I think people have to do whatever makes sense for them in the moment is my personal opinion, because if you're not going to stick with it and you're not going to do it, then what's the point, right? If it's something that feels like a chore, if it's something that feels like, oh, I've got to do my self-care, then why? Instead of, let's like the banjo that someone suggested, if sitting down and kind of playing with that banjo for 15 minutes, it takes your brain away from whatever you were worried about and whatever you were focused on. And you're so in the zone with that banjo playing that it almost is meditation, right? Because our brain can only really focus 100% on one thing really well. I know we pretend like we're really good at multitasking, but if you look at a lot of research on pain, like chronic pain, they've done a lot of research that if they can get those chronic pain patients to really focus on something in their zone, something they love, the pain falls away, and it's amazing. It's just really difficult to get people to believe in that and to find what they like. Shannon says, for the record, learning banjo is not Zen. But it's joyful, I bet. But if you can forget, like you're talking about, Marty, your ritual is as you're driving home. And so you're like, I'm going to let these things go. And maybe you physically imagine letting go of whatever burdens you carried around in the day. That can work for some people. Other people need to play the banjo for 15 minutes and get into how do I figure out these chords and how do I, ooh, that doesn't even sound like hot cross buns or whatever song you start out on in the banjo. I think that's recorder. Maybe hot cross buns is for recorder, but anyway, and if you get in that zone, you naturally let go of all those moments of baggage that you were carrying around in the day. But I think just reminding people to take time for that, because it's so essential. And again, we don't want to get to that point of burnout, where you have no capacity to even think about anything. You're just always in catch-up mode or panic mode. So.
All right. We
Yeah.
really appreciate your time today, Rachel. Thank you.
Thank you. It's a pleasure.
All right, folks.
Take time for you if you can.
Absolutely. Have a wonderful weekend, everybody.
Go and be well. Bye.